Travis Scott's broken knee. Let's talk about it. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel where I talk about broken bones and other stuff. Today, we're going to be talking about Travis Scott and his busted knee. Or was it really busted? So Travis Scott appears to have injured his knee at the Rolling Loud Music Festival in Queens, New York on October 12th of 2019. He apparently took a bad fall while performing the song Butterfly Effect. After injuring himself, he told the crowd that he, quote, legit thought that he had broke a bone. But, like a trooper, he went on to finish the performance anyway. And just like Billie Eilish, whom I talk about in a recent video, he injured himself while dancing. I'll leave a link to that video down in the description below. He told the crowd that although he thought that he had broken his knee, the show just couldn't stop.
The show could not stop, yes sir.
And he was able to finish the performance with some kind of tape or brace around his knee. So apparently some insiders reported to TMZ that he had gone to see orthopedic surgeon ElAttrache. And this is the same orthopedic surgeon that I talk about in a recent video on Klay Thompson and his ACL injury. TMZ reports that ElAttrache told Scott that he had suffered a dislocated knee and that he had probably stretched or partially torn his patellar tendon. ElAttrache also apparently told him that he wanted to wait a few days to determine whether or not surgery would be required for this injury. And as it stands right now, on Tuesday, October the 15th, which is approximately 3 days after he injured himself, there is no news yet as to whether he has actually undergone surgery or not. The word from TMZ though is that Travis preferred a surgical approach to this injury so that he could get back to playing basketball as soon as possible. So I'm sure there's a lot of questions that you might be wondering at this time, so let's get to them. So number one, what exactly is a knee dislocation anyway? A knee dislocation is an injury where there is a loss of continuity or a loss of the relationship between two adjacent bones. In this case, the femur and the tibia. That just basically means that the thigh bone and the shin bone are no longer connected by the ligaments in between. Question number two, did he really break his knee? A knee dislocation is not a broken knee. Often, it does not involve fractures or breaks of the bones around the knee. Instead, a knee dislocation typically only involves disruption or tearing of the ligaments around the knee. So, no, he did not break his knee. On some occasions, a knee dislocation may actually be part of a larger spectrum of injury, meaning it could be part of a fracture dislocation of the knee, in which case there are both fractures and dislocation of the knee at the same time. But in this particular case, there were no fractures, just a dislocation. Sometimes when people injure their knee in this manner, they may hear a pop or a sound that leads them to believe that they actually fractured or broke their knee. However, a ligament injury can produce either a tearing or a popping sound and is not necessarily associated with a fracture or a break. Question number three, how did he do this just from jumping? Well, if you look at the video from TMZ, you can see that as he was jumping, he was actually moving around the stage and changing direction at the same time. When he landed, immediately before injuring himself, he was kind of off balance to his right-hand side. You can see that his knee fell into dynamic valgus as he was falling. And this just basically means that the knee collapsed inwards to the midline rather than outwards to the outside. And if you've watched any of my other videos on knee injuries before, then you'll know that the dynamic valgus position is one that is usually associated with ligament injury. In particular, injury to the anterior cruciate ligament, or the ACL. So it's interesting in this case that he suffered a dynamic valgus injury and yet he injured his patellar tendon and not his anterior cruciate ligament. Or at least that's what TMZ is telling us. We'll have to find that out from Dr. ElAttrache or from Travis Scott when he releases a statement. There are 4 ligaments that are within the knee and 2 tendons that are outside of the knee. The ligaments that are around the knee include the medial collateral ligament on the inside, the lateral collateral ligament on the outside, and the anterior and posterior cruciate ligament which cross in the middle of the knee. Also crossing the front of the knee are the quadricep tendon, which attaches to the top of the kneecap, and then the patellar tendon, which attaches to the bottom of the kneecap. And in this particular case, TMZ has reported that he injured his patellar tendon. So this is the tendon that travels from the bottom of the kneecap to the top of the shin bone. And this tendon is used to hold the kneecap in place when you bend and straighten your knee. Typically, the patellar tendon is injured when there is forced knee flexion at the same time that the quadricep, or the muscle on the front of the thigh, is maximally contracted. So this basically means that you're being crushed by a heavy weight and you're trying to stop it. Now, it can occasionally happen when you are landing from a jump or falling and trying to catch yourself, but usually this is only in an elderly or very sedentary population of patients. And since Travis Scott is only 28 years old, maybe he's more sedentary than we know. Question number 4. So why would the doctor wait before deciding to operate? Oftentimes we want to wait for some of the swelling and inflammation to resolve before we take the patient to surgery. Also, when we examine these patients close to the time of injury, often the knee is too swollen to allow us to get an accurate diagnosis and a good examination. So sometimes we'll wait for a short period of time to allow the swelling to resolve so that we can re-examine the knee to make sure that our diagnosis has been accurate. Also, if there is a significant amount of swelling in the soft tissue around the joint, sometimes we will wait for a few days to allow that swelling to resolve so that we can be sure that we will be able to get our wounds closed after the surgery. In cases where there is an abundant or large amount of swelling around the joint, wound closure is a significant problem that we may need to deal with after we have performed the stabilization of the knee or the repair of the ligaments. Question number 5. If Dr. ElAttrache does operate, what will he do? Well, the answer here depends on what the actual diagnosis is. So if we assume that the information from TMZ is correct, and that Travis Scott has suffered a partial tear of his patellar tendon, then the procedure that he will most likely undergo is a repair of the patellar tendon. The location where the patellar tendon was injured will determine the type of repair that Travis Scott will undergo. The tear can occur in one of 3 locations: where the patellar tendon inserts on the kneecap, where it inserts on the shin bone, or somewhere in between. Generally speaking, the tendon will be repaired using a suture anchor technique. And this just basically means that they will use implants onto which sutures have been attached to repair the patellar tendon. If the tendon has been torn away from the kneecap, the suture anchors will be placed in the kneecap and the sutures used to bring the patellar tendon back to its attachment on the kneecap. If, on the other hand, the tendon has been torn away from the shin bone, then the anchors will be placed in the shin bone and the sutures used to bring the tendon back to its attachment on the shin bone. If the tendon has been torn somewhere in its mid-substance, then the anchors can be placed in either the patella or in the shin bone and the sutures used to bring the mid-substance repair back together. Question number 6. If he doesn't operate, how is it going to heal? In the case that the patellar tendon has just been stretched and it has not been ruptured, or it has a very low grade or very small tear in the fibers of the tendon, then this is a problem that can be treated non-operatively, usually with cast immobilization. And in this particular case, Travis Scott would either be fitted with a long leg cast, meaning a cast that goes from his hip down to his ankle, or with a rigid knee brace that extends from the thigh down to the shin, which keeps the knee in a locked position. And this will allow the patellar tendon to heal over a period of approximately 6 to 8 weeks. After that time, once healing of the tendon has been confirmed, then he will be allowed to take the knee through a range of motion with the assistance of a physical therapist until he has been able to restore his normal range of motion of the knee. Question number 7. Will he be back to normal? Assuming that Travis Scott is a healthy young male with no significant comorbidities or other medical problems, then after a period of healing, Travis Scott should be able to return to normal. it is very likely that he will have to go an extended period of physical therapy before he can do all the things that he used to do before the injury. However, in all likelihood, Travis Scott will be able to return to normal within a period of approximately 5 to 6 months. Finally, question number 8. Could this have been prevented? Well, to be honest, I think this was kind of a fluke and it's not anything that could really have been predicted. But training for strength, mobility, proprioception, and body awareness are always beneficial and can help to reduce the chance of injury when you find yourself in an awkward position. For more information on just those type of exercises, you can check out the Human 2.0 YouTube channel. And maybe Travis Scott should do something other than just playing basketball. Today we've been talking about Travis Scott and his busted knee. Like, share, subscribe. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.